So I spoke about the use of therapeutic exercise in the setting of patients with advanced cancer, and I explored the ways people have studied the use of exercise programs both alongside and after cancer treatment, principally chemotherapy. Patients with cancer have a multitude of symptoms and complaints, and there's a high risk of patients becoming inactive, and they experience symptoms when they exert themselves. That leads to people becoming more sedentary and inactive, and there's disuse, atrophy and deconditioning, and so the experience of those symptoms at progressively lower forms of exercise or physical activity. So exercise is really a useful way to help patients maintain their independence for as long as possible, and it's only recently that we've started to explore its use in patients with advanced disease and metastases, and its use alongside their cancer treatment. There's a handful of exercise trials where typically people have offered an outpatient-based exercise program, and it will be similar to the sorts of things our patients with respiratory or cardiac disease are getting currently. I think cancer is slightly behind in terms of the services that are being offered. Patients might come to a gym or a hospital setting, for example, twice a week for a 6-week period, and in a 90-minute session of exercise there'll be a warm-up and a cool-down, and the bulk of the program would be some light aerobic exercises and some resistance or strengthening exercises as well. So those programs are definitely helpful to a select group of people, but unfortunately if we look at them as a group, then it does seem that a select few are currently benefiting from them programs. Because of the inconveniences and the burden of undertaking any form of exercise. For many people, exercise is part of their life before a cancer diagnosis, and so there's no real reason why they should suddenly become motivated and engaged in exercise in the presence of symptoms. Certainly, there's lots of psychological benefits from exercise that have been reported in early stage cancers and indeed in many chronic disease states. There's an improved sense of well-being and a sense of empowerment and being able to undertake a task and take control of your daily schedule. There's also improvements in mood and psychological well-being. In select examples, we also see things like patients are becoming more active as the result of an exercise program, and being able to do more, they're more likely to do more on a daily basis, and improvements in things like sleep and circadian rhythm. So the whole parcel of what anyone could expect from engaging in exercise, I think the key is to make it accessible and acceptable to our patient group. There is a dose response to exercise, and what that means is the more you do, the better. And if you do anything, then that's better than doing nothing. And so even light forms of exercise like housework, taking a gentle walk, or perhaps doing light gardening are by no means a bad thing for patients. And one thing to avoid perhaps is, because of all the love surrounding the patient, their spouses and family and extended network take off all of the daily tasks that they would typically do to build up the amount of activity they're doing. So there's nothing bad about doing light forms of exercise around the home environment, and indeed perhaps talk to your professional team and the community services, and there will be increasingly services which are happy to guide cancer patients through their exercise programs and make use of the facilities that are available.